and welcome back to my channel. Today's video is part 2 of the music therapy and early childhood development series. The last video was on newborn, so naturally this video is on music therapy and infants. If you are new to my channel or unfamiliar with music therapy, I'll show the proper definition from the American Music Therapy Association up on the screen for you. My shorthand definition of music therapy is when a board-certified music therapist uses music to help their clients reach non-musical goals. As you can tell from the definition, this video is not music therapy. It is meant for educational purposes only. At the start of each video, I review possible non-musical goals for the population of focus. So for this video, infants ages 4 to 12 months old. As with the latest video, the non-musical goals for the population today are going to be based on the developmental milestones that little ones are expected to reach during infancy. You'll notice that the developmental milestones for infants fall into 4 categories: motor skills, visual or problem-solving skills, language development, and social skills. As the Cleveland Clinic says, developmental milestones track behaviors that mark stages of growth for your baby. Each milestone of your baby's development focuses on 4 aspects of their growth. Since infants are developing so quickly during the 8 months of infancy, I'll divide the goals further into sets of months or stages of development, starting with month 4 and ending with month 12. I'll review the milestones that are typical for sets of months and then show the music therapy research that we have for that stage of development in infancy. I'll then show how instrumental music therapy can be at helping infants and the parents and caregivers of infants as they seek to reach each milestone in a timely manner. I'll also end the video with a few other fun tidbits of information regarding music therapy in infants to help you best enjoy assisting your infant with their developmental milestones. So let's dive in. From ages 4 to 6 months, your infant should be ready to start trying new foods and then should reach a point where he or she is able to eat 3 meals that include solid foods daily. These foods are generally cereals or pureed fruits or vegetables. They're also expected to roll over, lift both hands, hold their head up, laugh and babble, recognize familiar faces and respond to their own name, and to start sitting upright. Research from music therapy journal articles show that infants ages 4 to 6 months respond best to positive affect, a loving tone of voice, and songs rather than speech by caregivers. Knowing this can help us best teach and interact with infants at this stage to assist them in their developmental process. In one study, 15 mothers were recorded singing a song of her choice to her 4 to 7 month old and then singing the same song alone. The results indicate that mothers modify their singing in the presence of their infants and that infants highly attend to these changes. And what adults perceive to be a loving tone of voice is highly salient to infants. From this study, we learned that it is appropriate and beneficial to adjust your tone of voice while singing to infants of this age. In order to get your infant's attention for learning or play purposes, you will want to modify your singing or tone of voice to sound more positive and loving than you would if you were interacting with another adult. In another study, 5-month-old infants listened at home to one of 2 novel songs with identical lyrics and rhythms but different melodies. The song was sung by a parent, it emanated from a toy, or it was sung live by a friendly but unfamiliar adult, first in person and subsequently via interactive video. The researchers desired to discover the power of the infant's memory with these novel songs and to discover if the source for learning the song had a different impact. They found infants' remarkable memory for the familiar melody tested an average of more than 8 months later, and their findings suggest that melodies produced live and experienced at home by known social partners carry social meaning for infants. From this study, we learn not only the strength of musical memory of 5-month-olds, but that there is a special connection between the parent or caregiver and the infant that has a greater effect on their memory as well. If you are a parent or a primary caregiver, I would recommend making a point to sing certain songs to your infant that you know that they will hear when they are at their grandparents' house, at childcare, at preschool later, at Sunday school, anywhere that you expect your infant to spend a lot of time, so that when your infant hears that familiar song in an environment, they will feel as comfortable as possible in the different social setting and will be able to adapt to these settings and therefore other settings in the future more successfully. I recently picked up my friend's 8-month-old and I put on a playlist of songs I knew he was familiar with while we were in the car. Within just a few minutes, he started babbling along to the songs he recognized, and it helped keep him awake until we arrived home for his nap time 20 minutes later. But moving forward to infants at 6 months of age, according to the CDC, your infant should be able to look at themselves in a mirror, take turns exchanging sounds with you, squeal, grab toys, put things in their mouth, close their lips and turn their head away if they're done eating, and to push up or to roll from tummy position. Studies of music therapy in 6-month-old infants again show us that these little ones respond best to positive affect. As you desire to increase your infant's ability to interact and exchange sounds with you, keep in mind that using positive affect and adjusting your tone with your little one will lead to the best results. One particular study on this concept used a set of experiments to elucidate the basis for a 6-month-old's listening preference by independently manipulating affect and speech register. The researchers found that infants' preferences followed the positive affect. Higher and more variable pitch was neither necessary nor sufficient for determining infants' preferences, although pitch characteristics may modulate affect-based preferences. Another practice you can use to both increase their exchange of sounds with you and to incorporate your infant using grasp is to use the cleanup song. You will want to make sure to use happy sounds and facial expressions to hold their attention, and it'll work best if the song is first sung by a primary caregiver and then other people can use it later on. Even though your infant is not yet able to walk around and to pick up toys and to deposit them in the correct spaces, using positive affect and song, the caregiver can hold the attention of their little one while demonstrating the desired task, and thus enabling their infant to associate a simple chore with positive emotions. You can allow your infant to grab at the toys, and then you can help them put them away. Their memory connected with the song will help them grasp the new concept quickly. Also, using songs for transitions incorporates the pattern of expectation that we reviewed in the last 2 videos. In case you were wondering if singing is really that much more impactful than speaking to your infant at this age, one study involved infants who were 6 months of age that were presented with extended audio-visual episodes of their mother's infant-directed speech or singing. The visual fixation and initial fixation of the mother's image were longer for maternal singing rather than maternal speech. Another study stated that much is known about the efficacy of infant-directed speech and singing for capturing attention, but little is known of their role in regulating affect. The researchers conducted 2 experiments using infant-directed speech, adult-directed speech, and songs in an unfamiliar language, specifically Turkish, to determine which of the 3 delayed the infant's signs of distress the longest. So if a certain stimulus was known to create infant distress, they would use one of those 3 mentioned, the infant-directed speech, adult speech, or singing, after the stimulus to attempt to delay the infant's automatic response of distress. They found in both experiments that the infant-directed singing was considerably more effective than speech for delaying the onset of distress. They suggest that the temporal patterning of infant-directed singing with its regular beat, metrical organization, and tempo plays an important role in inhibiting distress, perhaps by promoting entrainment and predictive listening. Thus, not only is singing best for holding your infant's attention, it is also best for helping them handle distress. As I mentioned in the last video, if you are comfortable singing and making up songs, you can take this tip and run with it Sing about breakfast, about preparing to go for a walk, grocery shopping, or anything that you and your child regularly do together. With those songs, your infant will grow in their ability to pay attention to you and to know what to expect of the day. One other study I wanted to review for this age group examined mothers who sang to their 6-month-old infants for 10 minutes, after which they continued interacting for another 10 minutes. To estimate infant arousal, the researchers gathered saliva samples from the infants. They found that the songs did affect the infant arousal states. The researchers stated these findings are consistent with the view that maternal singing modulates the arousal of prelinguistic infants. Another study sought to determine the effects of all versus certain types of music on the infant states of arousal. In that study, the mothers repeatedly sang Twinkle Twinkle Little Star to their infants, alternating between soothing and playful renditions. The infant attention and their mother-infant arousal, for example, skin conductivity, were recorded continuously. These findings highlight the contrastive nature and consequences of lullabies and of play songs. With these studies, we better understand how music can be used to help infants prepare for nap times or bedtimes through lullabies to lower their states of arousal, and how playful songs should be used after a nap or after waking up in the morning to help the little one prepare to engage and interact with others or to stay awake during feeds. For months 7 through 9, your infant should start eating finger foods, which will help them practice their fine and gross motor skills and introduce still more foods to their system. They should also be using their voice to express feelings, should be playing peekaboo, understanding no, and distinguishing favorite toys. Studies for this age group again show us that happy sounds are preferred by infants. One study says overall, happy voice quality rather than vocal mode, speech, or singing was the principal contributor to infant attention regardless of age. Here, you can begin speaking to your child more often. Just keep in mind that they will respond best if you're using happy sounds with positive affect. Exaggerated emotions are easier for them to comprehend, and as they begin to express emotions, they will often mimic the examples that you have provided them with. Since an infant ages 7 to 9 months should be practicing fine and gross motor skills, this is a great time to introduce motions to songs like Twinkle Twinkle Little Star that your baby can start to imitate. Other popular songs with motions include The Wheels on the Bus, Baby Shark, Itsy Bitsy Spider, and Row, Row, Row Your Boat. If you keep up with my socials with the Instagram or TikTok, I'll be posting videos that include these songs with motions for you in the next week. Months 9 through 12 are exciting as your infant should start saying their first words, usually mama or dada, and they will start pulling themselves up in order to stand. They'll also keep you on your toes by beginning to shake and toss objects and to explore their environment. It is not unusual for your infant to also be more clingy to you and other caregivers during this time. Again, if you're planning to pass your infant off to babysitters, etc., having those people learn to sing songs or to use playlists with familiar songs that your infant knows can help your infant feel more comfortable in that new setting without you present. I have 5 more studies I want to quickly review with you. The first one is another one that examined infants' levels of attention to speech, singing, and visual stimulus. The purpose of the study was to investigate infants' preferential attention to singing and speech presented in audiovisual and auditory mode. The results of the study reconcile the seemingly contradicting findings of previous investigations and show that the mode of presentation affects infants' preferential attention to speech and singing. The facilitating effects of facial cues on the infant's processing of speech and singing are discussed. In other words, this is yet another study that stresses the importance of facial cues to capture and maintain infants' attention. In other words, this is yet another study that stresses the importance of facial cues to capture and maintain an infant's attention. The last 4 studies focus more on the behaviors of mothers of infants. In one study, each mother was recorded singing a song of her choice to her infant and singing the same song in the absence of her infant. The researchers examined the difference in acoustic modifications between the ways the mothers sang when their infant was the audience and how they sang without their infant listening. The researchers also noticed that many of these acoustic modifications likely attract infants' attentions, and play songs and lullabies likely communicate different emotional messages. As your infant learns to express and communicate emotions, you can use your own facial cues and tones of voice in song to present them with different examples of expression to use. These studies further enforce the idea that you can use different song types to increase or decrease your infant's state of arousal when desired. The third study starts by stating mother-infant bonding among humans is not only linked to infant survival, but also with a range of protective psychological, biological, and behavioral responses in both mothers and infants in the post-birth period and across the lifespan. According to the mothers of this study, the researchers found that singing is associated with greater increases of maternal perceptions of emotional closeness in comparison to social interactions. Mother-infant singing is also associated with greater increases of positive affect and greater decreases of negative affect, as well as greater decreases in both psychological and biological markers of anxiety. So not only does singing positively affect your infant's social, emotional, and motor development, singing to your little one can have a wonderful impact on your bond with your child and result in decreasing your own anxiety. The fourth study sought to investigate the temporal structure of mother-infant interactions with songs, with particular attention to two aspects: the singing of the mothers to the infants and the nonverbal behaviors mothers and infants produce in synchrony with the musical beat. After observing videos of the mothers singing to 3 to 8 month old infants and examining the behaviors of the infants during singing, the researchers concluded that infants were shown to be sensitive to their mother's emphasis by producing significantly more synchronous behaviors on some beats than on others. In other words, when mothers put a special emphasis on musical beats, their infants responded in behaviors that showed their recognition of the musical beat. This shows us, once again, that infants are taking their cues from their caregivers, and that parents or caregivers are able to use music to teach concepts to infants and to help in their development. The final snippet I wanted to review with you comes from a dissertation entitled Emotion Regulation in Infants Using Maternal Singing and Speech. Gaspin states, mothers, the usual primary caregivers, are particularly influential in regulating infants' emotions through precise timing and various forms of soothing involving physical contact, rocking, distraction with objects, or vocalization. The mother's efficacy in soothing her distressed infant is important not only for the immediate regulation of infant affect, but also for long-term self-regulation. Each point in the dissertation is further backed up by previously published research. So once again, we have research showing the importance of caregivers to help infants in multiple areas of development, movement, vocal expression, and emotional regulation. We've already reviewed many ways that music therapy can help infants in each of those areas of development, but if you are interested in reading a more in-depth paper, that one is a good one to choose. Again, all of my references will be linked below the video. To review, infants develop rapidly through their 4th to 12th months of life. The areas of development are divided into 4 categories, and music therapy can be essential in helping infants develop in all 4 of those areas in each stage of development. Furthermore, using music therapy with infants unlocks positive effects on the caregivers involved. If you are interested in learning about how music therapy can personally be used to help you and your infant in their particular stage of development, be sure to set up a music therapy consultation session with me on my website, Music with Mar. Sessions are 45 minutes long, and they allow us to dive deeper into a personal view of your infant's current and desired stage of development, as well as to review the best ways to use music therapy practices to help them get to where you want to see them. In the meantime, I hope this video gave you lots of useful information to incorporate into the daily life of your infant. Feel free to like and subscribe. Please leave a comment if you learned something new or if you try something new after watching this video. Until next time, thanks for enjoying Music with More.